Hi, welcome to the overview for KLOwen custom braces. So the big thing that we are trying to solve is that the problem with braces now is that we use the same set of braces for every patient that comes in, no matter what their bite looks like, no matter what the shape of their teeth. And so it's a one-size-fits-all system. And we all know that a one-size-fits-all really doesn't fit anybody perfectly, which requires us as the doctor to do lots of repositioning and lots of wire bending. And that extra wire bending and repositioning adds time to treatment, it adds office visits, and then every time we do those bends, it actually induces pain for our patients. And if we look at where we really lack with our stock wire prescription, it's in the torque range. We have so much slop between the wire and the bracket now, between just these two brackets in our finishing wire, 1925 steel wire and a 22 slot bracket system. There's 45 degrees of slop from tooth to tooth. And so what that looks like digitally is very little control over where the marginal ridges end up and where the lingual cusps line up on the posterior teeth. And so this is the big issue that we face with a standard one-size-fits-all system. The answer, though, is not just to put full-size arch wires in these patients, because it will actually create bigger discrepancies. Our prescriptions are actually designed to build in some overcorrections in certain areas, assuming that we're not going to get to full arch wires. And so if you look at the lingual cusp of the upper arch, you can see how the lingual cusp of the first molar is plunged palatally, and the 5 is plunged too far down. And so that in and out, it just creates a roller coaster effect on the posterior occlusion. So we shouldn't be filling the slot with a stock bracket system, but when we do things where it's fully customized, we absolutely need to do slot filling mechanics. So lots of studies. This is, I think, one of the better ones, looking at custom digital prescriptions and what they do for results and efficiencies. And basically in Dave Sarver's office, Dr. Profit did this retrospective study and found that class 1 patients spent about 37% less time in braces with 40% fewer office visits. And the results weren't worse, they were actually better. And so what we've done is, instead of having to manufacture all these customized pieces and then mail them out to you like all the other systems do, you actually inventory this kit of 27 brackets, and the group of brackets on the left covers all of the maxillary teeth 5 to 5, and then all of the lower teeth 3 to 5. The second group of brackets actually covers all the lower anterior brackets. They're a little bit narrower. And then we have 6 molar tubes with varying torques. So with 27 pieces, no matter what the patient's teeth shape and arch form and angle classification, skull classification, with these 27 pieces, we can make a custom treatment for every single patient we see. The other big thing is we designed the bracket slot to be just bigger than 19, because we know most orthodontists feel comfortable finishing in a 1925 wire. So we actually designed the bracket to fit very intimately with that. Filling the slot's really important if you actually want to get the most out of your digital setup. So it's kind of like Invisalign or in any other aligner system, where the prescription isn't a Roth or MBT. The prescription is, what does the patient need? It's patient specific. And so we start out with a position of the teeth to ideal, and then we actually designed the brackets and the wires to fit that final position. And it's all automated now. You simply click a button after you get the final position that you want, and then automatically the software is going to choose the best fit bracket, the best Lego kit bracket for each tooth. And so with a straight wire appliance, we've got a very thin layer of composite, and we can still offer 100% customization for every patient we see. To look at that from a manual process, this just shows you what the computer is automatically doing now is, again, starting with that ideal setup and then selecting the best fit bracket for each tooth. And so we have variations in thickness and variations in torque that always allow us to be within a 0.5 millimeter from the bracket base to the tooth surface. Once you have that final position established, you simply print the indirect bonding tray. So no model printing, you directly print the IDB tray itself. You can do this in office on the Moonray or the EnvisionTech printer, and then the prescription just will tell you which bracket to put in which position in the IDB tray. And it's all color-coded, so there's either the numbers that'll tell you the torque and the thickness, but for assistance, we've actually made it all color-coded, so it'll tell you if you need the red bracket for the upper right 5, the white bracket for the upper left 4, and it just kind of tells you for each patient which bracket belongs in the IDB tray in each position. And the other really nice thing about this system is we actually have the marks showing on the gingival margin of the bracket, so we can even do a verification to make sure that we have the right bracket in the right position. So if you look at the screen, you'll see that this is a blue bracket for the 7, a blue bracket for the 6, orange for the 5, white for the 4, and orange for the 3. Then you simply just load the adhesive. It's like an Invisalign attachment where you can actually see the contour of the tooth, so you know how much adhesive you need to add. Again, you can kind of see the visual color dots on the gingival margin. And then you go and just bond it in the mouth, just like the Invisalign attachments again. So you just do a quick 3-second IDB cure, and then the assistants will come back and set it longer. Once all the adhesive is cured, simply remove the IDB tray, and you're off and running. And so instead of having a position where we can only move a prescription, can only move the tooth to this one set position, what if we had brackets that can allow that bracket to go forward or backward to the marginal ridges line up? And what if we can control the whole range of possibilities needed to get the tooth torqued appropriately and have this control over every single tooth in the mouth? And the really cool thing was we actually did 3 consecutively set up cases with our bracket system and looked at the bracket selection of all 3 of these patients. And it was very interesting to find that even though they had pretty good skeletal classification, that they were all different. We haven't done 2 patients yet in a setup where we've used the same brackets yet. So every patient is really different. It's not enough to have a one-size-fits-all system and do these custom composite bases. There's really a lot of difference from patient to patient, and this true customization is really needed in order to deliver a straight wire appliance for everybody. And the big benefits of this are going to a straight wire appliance, the number of office visits drops significantly. The amount of patients chair time drops significantly. The biggest thing though is the doctor time. You know, we spend more than half of our day typically doing wire bends and repositioning. And so if we can actually eliminate most, if not all, of those adjustments, and instead just have it as a wire change where we're simply directing what type of ligation to do and which wire we need to be putting in at the next visit, we can do full orthodontic treatment in a very little amount of time in terms of how much doctor effort is required. So just like with Andrews, that was able to more than double the capacity from the orthodontist of 1970s to the orthodontist of the 1990s, because instead of having to put all those bends in the teeth between every single tooth in all 3 orders, we had to put some bends in, but not nearly as much. So we could go from seeing 15 patients a day up to 60 or 70 without increasing our overhead at all. And so it really just comes back to that, the digital assistant. It's really what Invisalign was saying with the plastic assistant was, where because you've done all this work and it's all customized and it's all digital and it's all automated, the treatment, and standardized, it's not actually the plastic assistant, it's the digital assistant. Having something where you've got your treatment plan and your final result already established ahead of time really lets the doctor step back and use much less staff, much fewer office visits. Really the efficiency here is phenomenal. So once you get the brackets in position, it's either a 16 or a 14 NiTi to start, 1919 Bioforce NiTi, and then right now we're using an 1818, but the 1919 is in the works. The final wire would be a 1925 TMA or stainless steel. After that, you can do one adjustment bend if you need to, or you can actually do mid-course correction and scan, order new IDB trays to just change the position of various teeth in the mouth. So you can actually make this true straight wire even if you didn't get the prescription exactly right at the beginning, if you maybe guessed wrong on the anterior torque. And then if you need to do extraction space closure, we have a high torque stainless steel 1725 wire, so you can actually get full engagement of torque in the front, but have nice sliding mechanics in the back. So if you think about putting the brackets on, putting the first wire in, letting that work, putting the next wire in, letting that work, and then putting the final wire in. And if you think about what the doctor had to do to get this case from A to Z, there was very little minimal effort involved. And so that's the beauty of digital and custom, is we can really streamline the doctor's efficiencies. So shorter treatment and better outcomes don't have to be mutually exclusive. We're not trying to shave time off treatment with an inferior result. This was true about the straight wire appliance for sure. We actually, I think, got better results going to having a more of a standardized bracket prescription that didn't require so many bends. And I think it's true for sure about digital custom as well. It's just that next jump in the evolutionary chain. the other big thing to think of here is there's a lot of things that do accelerated tooth movement, like Propel and Accellident, but velocity is going to be way less important than the accuracy and precision of tooth movement. If you think about how far a tooth has to move to get from A to Z, it's not very far, and if we can just make sure we're moving it in a direct line, that's going to save us much more efficiencies than any sort of accelerated tooth movement. And just like Andrews took less than 10 years to get a prescription to replace a zero prescription, the digital custom is going to do the same thing. Within a decade, and whether it's KLOwen or Insignia or a new company that's yet to come out, this is the future for sure. It'll totally displace conventional braces for sure in the next decade. So just knowing that, the big things that we really need to focus on is orthodontists to make that transition happen is we really need to get good at digital treatment planning, not just with plastic, but also with brackets and wires. And then we need to get good at 3D printing and indirect bonding. So those three skills are things that I'd say, even if you don't want to dive all in, you really should start honing those things in your practice right now. And so why digital? And we've all heard the adage of if you put the braces in the right place, the case treats itself. But I think what we've hopefully shown today is that's not fully true. You really have to put the right braces in the right place to treat itself. And this is an orthodontist product, by orthodontists for orthodontists. This is something that when you have a powerful tool like this where you're filling the slot using custom prescription, you have to have an expert diagnostician and an expert treatment planner at the quarterback position. It can't be a general dentist leading this because it's super efficient, but you have to really know how to do it the right way in order to make things sing in this digital world. So please follow up with us if you have any more questions. Please email Corey at KLOwenbraces.com. Check us out on our website, and we really look forward to working with you more. Take care.